Hey everyone, Dr. Verma here. So I just want to show you some injection things for those of you who are taking BPC. These are the supplies that you should have. This is all on the PDF, so I don't need to go over them, but basically I have 10 1cc or 1 milliliter syringes. We have needles. I like the 27 gauge ½ inch, that's for injection, and this is just a larger size needle for drawing up. So those will all be on the PDF. So I'm just going to get started on showing you the actual process of what this looks like. And so we have clean hands first, so I've already washed my hands before this. I'm going to be doing this for all 10. Normally I would do all 10, but for just this video I'll just be doing the one. So you just take this and you put, this is the larger size needle because I'm going to be withdrawing and filling up all of these 1 milliliter vials right now. So that can be put down. Here's the vial of the BPC, which you should have. That can come off. If you're going to be doing this over and over or putting the vial away, you can give it a quick alcohol wipe, but this one's fresh because we just took the seal off. So I expose the needle. I like to hold it, I'm left-handed, hold it in your dominant hand, and then in your non-dominant hand, you're going to take your vial. I turn it upside down like so. I personally like to use a finger so I can stabilize the needle. I take a little bit of air out. I insert. I push the air back in. And I'm going to fill this entire amount. I see air in there, so I just push some back in. And I pull back again, and now it's clean. I can see there's no air now. Take that out. With recapping needles, be very careful. Don't be lackadaisical on this. You want to just put it on, and then just let it sort of fall on like that. From the bottom, push that down, and then twist off, and that one is done. I would then use the same needle to do the remaining 10. I do all 10 at once, and those will all be going in the fridge afterwards. I'll put this to the side. Next, I'm going to take all 10 that are done, but we'll assume these are all done now, and I'm going to put the small needle, the 27 gauge needle, on all of them. So each one now has those, and let's just pretend we would have done all 10, and all those will end up looking like this with the needle on those. I would then put all of those into the fridge, and I just keep one of these at my bedside now, which is going to be for the nighttime injection. So we're just going to go ahead and show the injection now. So again, very simple. We're going to take, well, clean hands. We have just an alcohol swab here. In general, I'm just going to sit down for this. It's a bit easier if you sit. So you just want to go into the belly, find a little piece of some belly flab there, and just give it a quick little clean wipe. Don't need to go too aggressive with it. I like to wait about, a few seconds, just kind of just like let that dry. It's just a bit irritating if you go into the skin otherwise. So take your needle, you're going to carefully, and always make sure you're holding the bottom of the needle because it could just kind of dissociate from the syringe. So you're holding, and there you go, you expose with the cap there. A little pro tip is every time you use it, pull the syringe back a little bit and then push it back up to get a little drop of liquid, and that way it's not sticky. These get sticky when they sit there overnight. So that's done. Find a little thing of skin. You don't want to go straight in, you don't want to go straight horizontal. We're talking about a 30-degree angle, in like this, pinch, in, and in general you'll be pushing about 0.333 out. Pull it out. You could use a little cotton swab or tissue just to dab it. Again, we'll show that nice recapping style. I'm just going to gently let this just sit over top, let it fall, pull from the bottom, and this is done. You can, if you're using it only on yourself, I think it's fine to reuse that for the next 2 injections to clear out that whole needle. If you want to be extra cautious, you can certainly use a fresh needle for each time, and that should be all.